And also the traumatic brain injury waiver. Those are for individuals with traumatic brain injuries that qualify for nursing facility level of care, that are adults between the ages of 18 and 64, and that can be safely served in the community. So just kind of an overview of the waiver eligibility process. There are multiple steps in getting access to those waiver services. The first is Medicaid eligibility. All of the waivers require that you are eligible for Medicaid in order to be eligible for the waiver services. So my team really works with the Medicaid eligibility side. And then when we intersect with several other units that help in completing that um, waiver eligibility. So we're going to go through kind of each of these steps tonight. The Medicaid eligibility, the disability determination, if it's needed, and we'll talk a little bit more about that. We're going to talk about the level of care process, the person-centered plan, the consent, and the waiver eligibility. So I'm going to focus more on the Medicaid eligibility sides of things. We're going to kind of touch on some of those other ones. But there are multiple steps in here that other members of our DHHS team take a little more ownership of. Crystal may be able to speak a little more to the level of care. And then our service coordination teams really work with the person-centered planning and the consent to get those final steps before we have waiver eligibility. So as you can see, there are multiple steps. There are also multiple handoffs to different parts of our team in determining eligibility. So there's a lot of coordination that goes on between the different parts of DHHS that are gathering the information to determine waiver eligibility. Overall, to be eligible for waiver services, you must be a Medicaid recipient in a full coverage Medicaid category or eligible with a cost share. Which means you need to meet Medicaid financial and non-financial criteria. You must have a disability determination or meet eligibility for developmental disability services and be eligible for Medicaid in another category. Meet the appropriate level of care. Depending on which waiver will depend on what level of care that we're looking at. You need to be able to have a person-centered plan that allows you to remain safely in the community, and then having the appropriate consents and paperwork signed. So if all the criteria are met for children under the age of 18, that also means that if there is waiver eligibility, we have the opportunity to disregard parental income and resources. So once we have all those pieces in place is when we can disregard parental income and resources. The other thing to know is waiver eligibility cannot be backdated. So all these pieces have to be done in order, and we have to get all the pieces and parts in place before we have waiver eligibility, and then waiver eligibility can start. Waiver services can't be backdated. However, there are circumstances where Medicaid eligibility could potentially be backdated. And we'll talk about that a little more as well. So moving forward, just kind of going over some Medicaid eligibility requirements. Some of the basics of Medicaid eligibility is to have U.S. citizenship or a qualified immigration status. Qualified immigration status is verified through Homeland Security. It's done through an electronic interface. There are many different qualified statuses and many different entry statuses for individuals that are coming into the country. Really, those are done on a case-by-case basis. There are individuals in families where one person may have an eligible status and another person in the same household may not have an eligible status. So we review citizenship and immigration status at initial application. We also re-review it anytime that we are doing a redetermination or doing a renewal on that household. There have been some changes federally on allowable immigration statuses. Some of those will be changing in October of 2026. We are still waiting for a lot of information and guidance from our partners at CMS on exactly what that's going to look like and how that's going to play out. So unfortunately, I don't have a lot more information on that right now. Residency, quite simply, you need to be a resident of Nebraska. Nebraska does not require that you're in the state for a specific length of time prior to applying or being eligible. Basically, if you're in the state of Nebraska and you declare that you intend to make Nebraska your home, you've declared residency. The only time that may come into play is if you are living in another state and move to Nebraska to directly enter a nursing facility, then there are some other requirements that we need to look at. But that is specific to residing in a nursing facility. Living arrangement. Basically, any living arrangement is an eligible living arrangement for Medicaid, except incarceration or living in a public institution. And then we look at every individual needs to have a Social Security number or be eligible for a Social Security number, and we will work with individuals. We have to have the number. We don't have to have like a card on file or anything. So we will work with individuals to get that information. Household composition, we need to know who all's in your household and what that household composition looks like. And then we're going to take a look at the income and resources of your household. So those are kind of the basic eligibility pieces that we are looking at with Medicaid. Whoops, went too far. This is kind of, I know this is like a lot of numbers on one piece of paper. I believe Chrissy said that she will be sharing some handouts with you later, so you will have the opportunity to look at those. This just kind of gives you a quick overview, number one, of the many different levels or different categories that individuals can be eligible for Medicaid under. We go all the way from, individuals that are under the age of 1 or pregnant women, all the way up to individuals that are over the age of 65 and maybe disabled. So what you'll see up at the top is kind of the percentage of the federal poverty level that each category looks at. And then going down the side is the number of individuals in the household or in the Medicaid unit. Medicaid has basically two different categories that we look at, two different categories of budgeting. One is called MAGI budgeting, modified adjusted gross income. That's the budgeting that went into play when the Affordable Care Act was passed. That looks at an individual's tax household and their tax household income for that tax household unit. And so with that, we're using IRS tax code to determine what's taxable income and what's not. And we are using countable taxable income in those budgets. On the other side is our non-MAGI, any that don't fall into the MAGI budgeting rules. Primarily, those are individuals that have a disability or are over the income limits for the MAGI categories and then move into a non-MAGI program. And in the non-MAGI programs, we look at both income and resources. In MAGI programs, there is not a resource test. So you'll see some resource limits down in the lower right-hand side, and that just kind of gives you some information about the resource limits that we're looking at there. Income limits are adjusted for cost of living once a year. That is done federally. Those numbers are generally announced basically end of November-ish. I think we know what the cost of living adjustment is going to be. those figures won't be finalized. They go into place in January, but they won't be finalized in any of our budgeting until approximately March of next year. So there's always a delay in establishing those COLA increases. Another category that we have available that's really not on that program chart that you saw just a minute ago is the Katie Beckett program. And I know there's a lot of interest in Katie Beckett. There's been some changes over the past couple of years with Katie Beckett. Katie Beckett is a Medicaid program category. It is not a waiver. And there's sometimes a lot of confusion. There's some very close similarities in some of the requirements. But Katie Beckett is a Medicaid program category. It's for children under the age of 19 with high-level needs. In order to be eligible for Katie Beckett, you can't be eligible in any other category of Medicaid or be eligible with a waiver program, because if you're eligible under the waiver, you're going to have Medicaid attached to it as part of the waiver process. So you can't have both. Katie Beckett does require a disability determination, either by Social Security or by our state review team. There are multiple levels that you can qualify for Katie Beckett under: hospital level of care, nursing facility level of care, or ICF IAD level of care. And then the final test on Katie Beckett is it needs to be cost effective. In other words, it needs to cost the state less money to support you on Medicaid through Katie Beckett than it would to pay to have your child reside in a hospital or in a nursing facility or in an ICF. And we basically compare those costs at time of annual redetermination, so at the renewal time, just to look at the billable services and if those are less than what the standard is for hospital, nursing facility, or ICF level of care. So the services that are available through Katie Beckett is all Medicaid services based on medical need, including nursing care in the home, hospital stays, medicine, medical supplies, durable equipment, and physician's fees. So with that, again, there aren't waiver services. There isn't a service coordinator assigned. The managed care organizations support, because it is all Medicaid services. Generally, there's a care coordinator that's assigned, and all the authorizations for services and the number of hours and all of that are determined by working through the MCOs. All right, the next step in the process after we've started the Medicaid eligibility process with that application on file will be determine if disability determination is needed. I said earlier, aged and disabled waiver always requires a disability determination. The developmental disabilities waivers will depend on if your household or if the individual is eligible in another Medicaid category outright without waiver assistance. If your family qualifies under the income guidelines with MAGI budgeting, then there would not be a need for a disability determination through Social Security or the state review team. Social Security Administration and the state review team, those disability determinations are time limited. Social Security reviews disabilities every few years. I don't know their time schedule, but they do their redeterminations every few years as well. State review team does the same thing. Depending on the diagnosis or condition, those with the state review team, those approvals or timelines can be 12 months. They can be up to 60 months. So it really depends on the individual and the condition and the diagnosis. So if a state review team is needed, so if Social Security has already made the determination and the individual is actively receiving either Social Security disability benefits or SSI payments, and they are current in that status, then the Social Security Administration manages that disability determination, and we don't need to do anything further. We take the information from Social Security. If Social Security has not or will not make a determination, a lot of times, especially with children, if the parent's income is above the SSI referral guidelines, Social Security won't even look at it. And at that point in time is when the state review team will make that disability determination. Social Security trumps the state review team. So if Social Security has already made the determination, SRT cannot, the state review team cannot overrule that determination unless there's been a significant change in condition that would warrant a re-review. So if the state review team review is needed, the eligibility of the Medicaid social service worker will attempt to contact the individual or the family representative to explain the process, what's all included in that state review team review, and confirm the waiver request. We get referrals from a lot of different places. And sometimes when we contact the family, they had no idea a referral was put in on their behalf. And it may not be a service that they're wanting or needing at that time. The other thing is there's a combination of things between the aged and disabled waiver and some of the developmental disability waivers. It's really going to depend on what the individual needs for support, which waiver is appropriate. And so about having those discussions about, do you really need supportive services? Are you looking for a waiver service that can support the individual in their household? Or are you looking just for the Medicaid coverage under the Katie Beckett program? And so we'll have that conversation to determine which path on our side it needs to go down so that we make sure that we're getting people to the right place the first time. Once we start the SRT process, the first piece of that is we're going to send out a verification request asking for medical records. Those medical records need to be within the past 12 calendar months. And really, we need it from all providers that are involved with the individual that really paint the picture of how their disability impacts their life and how it impacts their functioning. The state review team reviews all the medical documentations that is provided. It is a records review. There is no in-person interview or assessment that's done. It is based specifically on the medical records that are provided. So it's important to have all of those documents available for the state review team to review. All right. And then once the state review team does their determination, it's reviewed by medical professionals and re-reviewed by physicians. After the medical professionals have reviewed it, they use the same criteria that Social Security uses to determine disability. So there shouldn't be any differences between what Social Security is determined and what the state review team would determine. And then if disability criteria is not met, or if we don't get the information needed to review or to make a determination, the process really stops at that point in time. So, and that means that, if you're eligible for Medicaid straight out in an ongoing Medicaid category, that's great. But otherwise, there would not be Medicaid eligibility and there would not be waiver eligibility. If the disability determination is made and approved, like I said, that determination can be anywhere from 12 months to 60 months, depending on the individual. Then it moves to a level of care process. And the level of care assessment is completed by the eligibility and enrollment unit. Um, and really, there are several different levels of care that can be assessed for: nursing facility, ICF IID, and Katie Beckett. Those all have different criteria that we're looking for with those. And then just a note here that children under the age of 4 are assessed by the Early Development Network in their area for waiver eligibility. Crystal, I know you're on. Did you have anything you wanted to say about the level of care process?
Sorry, couldn't get my unmute. No, I don't think I have a lot of additions to that. I think you've pretty much covered it. So, yeah, we can do any of those level of care assessments for ICF level of care, nursing facility level of care. Our clinical team does those hospital level of care assessments for Katie Beckett and those children under 4. If they would like AED waiver, those go to EDN. My team does do the ICF level of care for those kiddos under 4. So that would be the only thing I have to add to that.
All right, thanks.
Wendy, we did have a couple of questions come in. If you'd like to take them now, or we can wait till the end.
We're at 7:05. If we could keep going and then
Okay.
take them at the end, that way we can jump in. I just want to make sure we get everything covered.
Okay,
Otherwise,
sounds
I will
good.
talk nonstop and we'll get totally off track and never finish.
That's
So,
understandable.
okay, thank you. After the level of care assessment has been completed, it then moves on to service coordination. And basically, the service coordinators are going to connect with the individual, ensures that the waiver supports can be provided, that each individual waiver has different waiver services available. And so making sure that we have the waiver services that are appropriate for that individual, that there is a safe plan that can be supported, that the person can remain safely in the community with those waiver supports, along with any other supports that may be available. Service coordination, depending on the waiver and the age of the person, can be either an internal DHHS service coordinator. It can be a service coordination agency with either some of our areas of I can't even say it, triple A's, area agencies on aging. Also do some service coordination for those over the age of 65. Like I said, with Katie Beckett, there is no person-centered plan piece on that. That is a Medicaid category. So that actually skips these next couple of steps with the person-centered plan and the consents and moves straight back to Medicaid eligibility. Like I said, as part of that person-centered planning, the service coordinator is going to make sure that we have the appropriate consent signed, that need to happen in order for the waiver eligibility to occur. So that's all part of that process with service coordination. And once those pieces are in place, it comes back to Medicaid eligibility. Because the waiver eligibility is dependent on Medicaid eligibility, basically Medicaid has to authorize a Medicaid budget in order for the waiver to be activated. So it comes back to the Medicaid eligibility team. Sometimes if we can determine Medicaid eligibility ahead of time, a person may be active in a Medicaid category before this is over. Other times we have to wait until all these pieces are in place before we can activate the Medicaid. So it really depends, especially with children under the age of 19. We have to wait till the consents are signed before we're good to exclude parental income and resources and get that Medicaid eligibility. So it's really kind of one big circle as we move forward with that. How to apply for Medicaid, just very quickly. iserve.nebraska.gov is the best place to apply. You can explore other benefits that your household or family may be eligible for. You can apply for benefits. It's going to walk you through. It's an interactive or kind of intuitive application that'll ask more questions to get you down the right path. Anytime you have the opportunity to click that you want waiver services, or if there's a comment box to add Katie Beckett, if you're looking at Katie Beckett eligibility, anytime that you can add that additional information in, please do. We know that our application, it would be really great to have great big check boxes that said, yes, I want waiver. Yes, I want Katie Beckett. Yes, I want this or that. Not all of our applications have that. We are looking at some enhancements for the application to make it more intuitive and give people the opportunity to see those check boxes or to have that screening up front. So those are some of the enhancements that we are looking at with iServe. Hopefully we will get to some of those soon. Applications can also be submitted by mail or completed at a local office. That paper application and the location of all the local offices, there's a link on this page that you can get to there. After an application is submitted, one of the requirements federally for us is that we attempt to determine eligibility without undue burden on the individual or the family. So basically, we're going to look at all of our electronic resources first. We have interfaces with Social Security. We have interfaces with the Federal Tax Hub. We have information from Vital Statistics. There's a lot of different, the Department of Labor. There's a lot of different electronic information that we have available to us. And we're going to attempt to gather all the information that we can to determine eligibility through those electronic sources. If we are unsuccessful in getting all the information that we need to be able to determine eligibility, we're going to reach out. We're going to try phone and email and text and mail in order to get that information we need to complete eligibility. Most times it'll be a verification request. Verification requests most likely will be sent out by physical mail. However, if you have set up as part of your application to receive either email or text notifications, you will get those email or text notifications before you ever get the paper mail. So it's a good way to get information more quickly. And by getting that through the iServe portal helps get that information. Once you have it, then you can gather the information and send it back to us more quickly. It just keeps the process moving. Ongoing eligibility, Medicaid's required to do an annual renewal. Medicaid continues as long as you remain eligible. We don't have a defined eligibility period where you're eligible for 1 year and then you need to reapply. It'll continue as long as you're eligible and we complete that annual renewal. There is a responsibility to report any changes in the household situation within 10 days. One thing to note, though, it's really important that you pay attention to the Medicaid part of the waiver services, because if Medicaid closes, the waiver closes also, because you have to have Medicaid eligibility in order to have waiver eligibility. So it's super important to respond and complete those Medicaid annual renewals so that we do not have a disruption in waiver services. If there is a disruption, it can take up to 5 days once the case is reopened to get everything through the system again. So the transfer of information back over to the MCO to get Medicaid eligibility in place. It'll take some time to get the information and the waiver services. Depending on how long the case has been closed, will determine if we need to repeat a level of care assessment or any person-centered planning updates or anything before the waiver can be reopened. So it just saves a lot of time if we can avoid a Medicaid closure. All right. Jennifer, you said you had questions?
Yes, we did. From the chat, is SSI based off of income of the family if you're applying for a minor?
That is technically a Social Security question to answer, not mine, but I can tell you yes. It is off of household income.
Okay. And then the next, I have an 18-year-old who was initially denied for SSI for lack of disability severity, so she lost her Medicaid when it was renewed. If we appeal the decision with SSI and changes to eligible, do we have to reapply for Medicaid?
So if you appeal the decision to SSI, that is one of the criteria under appeal, that if there's been a change in circumstance where you believe your child is disabled, although Social Security is under appeal, we can potentially do a referral to the state review team to review it while you're waiting the SSI decision.
Okay.
So if the case remains closed and you just wait for the Social Security decision on appeal, then yes, a Medicaid application would be required again.
Okay. And then another one on the appeal. On the notice of the notification where you're denied Medicaid on renewal, can you explain the 10-day timeline that's given on that notification to appeal within 10
To
days?
file an appeal?
Yes.
Yes. Okay. So with Medicaid, if you get a closure notice and you file an appeal within 10 days of the notice, then Medicaid can be reinstated during the process of the appeal. There is a caveat with that does state that you may be responsible if our decision is upheld. You may be responsible for any payments that have gone out on Medicaid's behalf during that time period. I have to say I have never seen that collected, though.
Okay.
Same thing with waiver services on appeal. If the waiver case is closed for any reason, for like not meeting level of care or something, you file that appeal within 10 days. Waiver services can be continued during that appeal process. But again, there is that stipulation in continuing services that if the department's decision is upheld, you may be responsible for those costs.
Okay. And then we had my son, who is 17, is new to Medicaid. I took him to a dentist, and they told me that we needed to add that involved dental to his Medicaid. How do we do this?
Dental services are a part of Medicaid covered services. And those are all managed through the same MCO that the health services are managed under. And so basically, I would talk to the MCO if there's needed dental coverage about, is there a pre-authorization or something that needs. We don't add on dental coverage. It's a part of the Medicaid package.
Okay. And then somebody asked for clarification on sending in the records to Medicaid and then also having to send in the same records to Division of Developmental Disabilities if you're applying for a waiver also.
Generally, if you send information into one of us, it should count for both.
Okay.
The state review team that reviews the medical records will review information that's been submitted to developmental disabilities, and developmental disabilities should have access to the records that were submitted for the state review team review.
Okay.
Crystal, that's accurate, correct?
Yes, that's correct. Yeah, if you run into that issue, please let us know, because we can look for those records and make sure that your assessor gets all of the information needed that's already in the system.
The
Okay.
other thing that may happen, and we've seen it frequently recently, is that there are two pieces. You may have filled out a request for developmental disabilities program and also waiver services to be considered under, or maybe it's Katie Beckett, one of the two. And so sometimes the developmental disability in making sure that you meet the statutory criteria for developmental disabilities overlaps with the Katie Beckett or the waiver process. And so you may get a request that is overlapping each other, and sometimes one part doesn't know that the other part's requested the same information. So if you let either one of us know that you've already submitted it for DD or you've already submitted it for state review team, then we can go look for it and find it and pull it together.
Okay. Good to know. If my child is eligible for Medicaid waiver, then would he have access to all of what Medicaid covers, such as ABA, speech, and OT, or just select services?
Medicaid coverage is Medicaid coverage. If you're eligible for Medicaid, you're eligible for all Medicaid services. Which services, though, or how much of each service, how many nursing hours, how much ABA is approved, all of that would go through the MCO for authorization on that. But we don't say you're eligible for one part of Medicaid or you're not eligible for another part. Medicaid, the whole Medicaid package services is all together.
Okay. Is there someone who would be available to answer more specific questions about their daughter's situation? Is there a contact that is available?
You can go on ahead and give me a call, and if I can't answer the question, I will connect with whatever part of our process that we need to make sure that I can get you connected to the right person.
Okay. We've had some more come in. This might be a Social Security question, but as of this month, my child will have Medicare, 2 years of Medicaid and / disability, and I received notice that Medicaid was closed. Is this just for medical and doesn't affect her waiver?
If Medicaid is closed, then there is not waiver eligibility. You have to have Medicaid eligibility in order to have waiver eligibility. So at that point in time, it's going to depend on why the Medicaid has closed. Sometimes we need to look at it differently. And because of waiver services, instead of being in a full Medicaid coverage category, you may be eligible with a share of cost. And that share of cost then would be obligated to the waiver providers. It's really going to depend on the situation. Again, if you want to reach out to me on that, I can kind of talk you through specific details on that.
Okay. Do we have to reapply on iServe.Nebraska annually for Medicaid, or will we get a notice when it's time to renew?
So again, as same with the initial application process, we are required to attempt to complete that renewal electronically before we would reach out and ask for information. So we will do what we can to check all of our electronic resources, make sure that you or your individual, your family member is eligible for Medicaid. And you would get a notice then saying that the Medicaid had been renewed. If the Medicaid has not been renewed, we're going to send you out a pre-populated renewal form that would then need to be completed and returned to us. So no, you don't need to go to iServe and automatically fill one out. Wait till you get a request that the form is needed. Once you get the form, we're going to mail out a paper form to you. It'll come out in the mail. If you have that iServe portal set up, you'll get an electronic notice that a renewal form has been sent to you. You have the option at that time then to go onto iServe and complete that renewal form online. So you can certainly complete it online, or you can wait and get the paper form. Once that form has been generated, though, that's saying that we need additional information. The form in one way or another has to come back to us at that point. So whether it's electronically through iServe or whether you complete the paper form and send it back in. Once we send it to you, it has to come back.
Okay. Can you give an estimated time frame of how long it takes for the waiver process or the application for Medicaid from the time you apply to coverage? How long has like the average time frame for that?
For Medicaid or with waiver
Sorry,
eligibility?
Medicaid, she was asking.
Okay. Medicaid eligibility is generally between 45 and 60 days. If Medicaid is dependent on the state review team process or the waiver process, though, that's going to extend the time because we allow for 30 days to gather the medical records, and then it takes approximately 2 weeks to get through the state review team process. Then it moves to level of care, and that team has to have time to schedule and complete the level of care assessment, and then it moves to service coordination. So basically, it really depends on the number of referrals we have that have to go through each of those steps of the process. Sometimes it can be 90 days, sometimes it can be a little longer.
Okay. Can you please clarify who is responsible for gathering the medical record documentation for the state review team? Do parents just sign a release of information for DHHS, or do parents have to gather all the records and then send it in to DHHS on their own?
Parents will need to gather the records and submit them.
If upon renewal, a client is determined to fall into a different Medicaid category based on resources or income, or they lose their Medicaid altogether, or it's closed for failure to provide, would it be beneficial for the client to appeal that decision while trying to gather the documentation that is being requested to be able to continue their benefits until everything is determined to continue eligibility so they don't lose services?
So if a case has been closed due to income or resources, and you feel that determination is not accurate, then I would appeal. If it's denied for failure to provide, we just need the documentation, and you need to get us that documentation. Failure to provide is not an appealable reason. So, I mean, you can file the appeal, but most likely it's going to get dismissed because you failed to provide the information and we can't make the determination. So the hearing officer is not going to hear that because we don't have the information. Does that make sense?
Mm-hmm.
So.
And is that listed on the notice of on their notice that it was?
Yeah, it's listed on the notice if the reason was failure to provide information, and we list on that notice what's missing.
Okay. How long after level of care assessment until the waiver eligibility determination?
So from the level of care assessment, it moves to the service coordination team. And the service coordination team would then need to meet with the individual and family or representative to set up that person-centered plan and get the consent signed. And so it really depends on how long it takes to get that scheduled and completed.
Okay, I think that's it for questions.
Going back to Nikki on that question for the dental, Involve that involving is a managed provider for dental. Nebraska is not part of that. It is only for some states, and Nebraska is not part of that. So you might want to check with your provider to see if you have any dental providers in your network. Um, maybe the provider that you're seeing is not part of your network, and that's why it's not being covered.